Hello, everybody. Welcome to our webinar about NCTF and safety. And for this special webinar about NCTF, our iconic product, I'm so pleased to present you Dr. Michael Alfertshofer from Germany, who is an anatomologist and in research. And he will present the main structure we are interested for NCTF and making a special focus on all the peri-ocular region. Then, Professor Alessio Redelli from Milan, hello Alessio, that you may know are more than loyal Alessio, and he will present the main, how would I say, vigilance case that can happen with NCTF and the best way to handle it. So now I will let the show to Michael with the main anatomy principles. Hello, Michael.
Hello, Valérie. Thank you so much for the introduction. I hope you can see my screen. I'm super excited to host this webinar together with you and to contribute with my favorite topic, which is facial anatomy. Basically, we're starting off this webinar by setting a foundation. We're going to revise facial anatomy, its layered arrangement, and how it relates to skin revitalizing treatments, especially NCTF. Before we dive deeper into facial anatomy, I would quickly introduce myself. My name is Michael Alfertshofer. I'm a doctor located in Munich, Germany. And over the last few years, I've been doing a lot of research in the fields of plastic surgery and especially facial anatomy. So I really hope I could give you some interesting insights today. So let's start simple. As you all know, the face is arranged in layers, and generally speaking, we can differentiate up to 5 layers in the face. So that's the skin as the most superficial layer, followed by the superficial fat compartments, also subcutaneous fat compartments, followed by a muscular layer, sometimes called SMAS. SMAS is short and stands for superficial muscular aponeurotic system, but beware that SMAS is only the official name for this layer in the midface. For example, in the neck, it's called platysm, which is one continuous layer with the SMAS. And in the forehead, it's the frontalis muscle. So always keep that in mind. The 4th layer are the deep fat compartments and followed by the periosteum or the bone as the deepest layer we can find in the face. So this 5-layer arrangement is a good general rule, a good rule of thumb. But anyway, there are exceptions to this rule, and I will go into more detail when we come to the specific facial regions. But it's good to have that in mind. For the scopes of this webinar, we want to focus on the anatomy of the 1st layer, which is the skin. The skin is the most superficial layer and also the layer which projects all aging signs. Obviously, only aging signs that project onto the skin can be an aesthetic concern. So what happens below the skin will eventually project onto the skin. The skin basically is composed of 2 layers, which is the epidermis and the dermis. And the epidermis is super thin with 0.03 to 0.06 millimeters, while the dermis is multiple times thicker with 0.76 to 1.97 millimeters. And when talking about skin revitalizing treatments, and especially NCTF, we have to understand where we apply our product. And in this case, we can safely say that we want to apply it into the dermal area, into the dermal layer. And this is easily possible when we take a closer look at the length of the needles of the nanosoft device, which are 0.6 millimeters. And that means we will end up straight in the dermal layer. And this is also the layer we want to target. So why are those facial layers actually important? Well, having this knowledge allows us as aesthetic physicians, just like in any other medical specialty to diagnose our patients and to understand what's happening below the skin. Obviously, all aging signs that might be a concern to the patient are projecting onto the skin. However, not all aging signs are being caused by changes in the skin itself. So, for instance, age-related reductions in fat compartments might lead to volume deficiency, which would require volumization rather than skin boosting. So we need to understand what the patient actually needs. And here I brought some different skin characteristics, and I'm sure you all have seen some of them, and you are all adapting your treatments depending on what the skin of your patient actually looks like. So, for example, in the thin skin, when it comes to fillers, for example, we can see the product more easily visible under the skin, while in thick skin, we might have a worse volumization effect. And these are some factors we have to take into consideration to approach the treatment of the patient more effectively. We also have to differentiate, are the wrinkles being caused by the skin itself, for example, when skin shows great laxity, or are they being caused by hyperactive muscles, in this case, the orbicularis oculi muscle. Also, always be aware that photo damage is commonly seen. The periorbital region is one of the regions that is most commonly treated, and also a great aesthetic concern. I'm sure you will all confirm the statement. A lot of patients are complaining about under eye circles and about a tired look. And what I always found is that the periorbital region is also a region that is super difficult to treat because we have a lot of complications, adverse events, and so on. And the reason for this is actually twofold. So the first one is that the periorbital region has the thinnest skin in the entire body. And the second reason is that it only has 3 layers. So the tissues are very thin also, not only the skin, but also the tissues. So we only have the skin, the orbicularis oculi muscle, and right in the depth, we can find the periosteum. And this is also the reason why, for example, the Tyndall effect occurs. So product shimmering through the skin, which can be seen right here, is easily possible considering the fact that the skin is super thin and that we do not have a lot of soft tissue anyway. But besides the increased risk for product show, for example, the Tyndall effect, we also have an increased risk for edema formation. And this is due to the delicate lymphatic system of the periorbital region. And this requires us to make our aesthetic treatments more precise, to make them on the one hand safer, but also more effective. Here we can see in a cadaveric specimen how the orbicularis oculi muscle can be found right below the skin here in its palpebral part and is being covered by subcutaneous fat in its orbital part. So when we're talking about the orbicularis oculi muscle in terms of treatments in this region, we're typically talking about the palpebral part, as the orbital part is basically just extensions of the orbicularis oculi muscle, which fuse together with midfacial muscles in layer 3. In this beautiful illustration, you can see the delicate lymphatic system I was talking about. In total, we can differentiate up to 3 lymphatic pathways, if you will. So the first one is the superficial one that's in front of the orbicularis oculi muscle and beneath the skin. The second one is below the orbicularis oculi muscle, and the third one is in the depth. So basically, for aesthetic injectors, only the first and the second one, so the superficial and the postorbicularis lymphatic system, should be a concern. And here you can see very nicely how the superficial lymphatic system is coursing just below the skin, and the pretarsal lymphatic system is coursing just below the orbicularis oculi muscle. And you can really imagine how you can injure those lymphatic vessels if you scrape along the periosteum, for example, with a cannula, and this will ultimately impair lymphatic drainage and increase the risk of edema. Also, a fact you might want to have heard if you're interested in facial anatomy is that the lymphatic drainage of the periorbital region actually has two pathways. The first one is the medial lymphatic pathway going to the submandibular lymph nodes, and the second one is the lateral lymphatic pathway going to superficial preauricular lymph nodes. Again, as we did for the general skin appearance, we also want to understand what the periorbital region looks like in patients and what is the cause of this appearance. So we have to differentiate. Are the under eye circles being caused, for example, by wrinkles? Are they being caused by pigmentation, by increased vascularity, or do we maybe have even a structural problem? And this is important because the first three appearances can very effectively be treated with skin revitalization, with skin glow, while structural problems and volume deficits might also need another component to its treatment, maybe fillers. And so we always have to think about combining treatments in order to be more effective for the patient. And here you can see how those single factors can come together and be combined in a patient. The neck is also a region in the face that is commonly requested by patients, especially when it comes to skin revitalization. And the good thing is the neck actually has very simple anatomy. So we can adhere to this principle of 5 layers. And the only exception is that we do not have a periosteum, but the periosteum is basically the deep cervical fascia. And there have been many theories about the etiology of aging signs in the neck, and also very interesting publications on platysmal bands. For example, one publication says that the wrinkles are being formed by connections to the tissue underneath with retention fibers that would require subcision. But in the same publication, they're saying that better aesthetic results can be achieved with precise intradermal needle injections rather than subdermal subcisions with cannula. And this is great news for us who we are trying to inject the product intradermally. The neck and the décolleté region show a great variety of different appearances and different aesthetic concerns. Here you can see a selection. Of course, there are many, many more. And again, we have to ask ourselves, what is the reason for this aging sign? And this is also why understanding anatomy and facial biomechanics and what is actually happening with the face as we age is so important, because when you take a look at the most left image and on the to the most right image, you will see that skin laxity and platysmal bands actually look quite similar, and they can easily be confused with each other if you don't have any experience. So this is why education is key, because skin laxity, of course, needs a completely different treatment approach than platysmal bands, when platysmal bands are obviously caused by the underlying platysmal muscle, and skin laxity is actually being caused by the skin itself. Also, the double chin and other structural deficits are not something we would holistically treat with skin revitalization. This is a nice add-on and definitely something we can offer, but always keep in mind that the aesthetic concern of the patient is what we're trying to treat. And of course, we're not able to erase a double chin with skin revitalization. So, another facial region that is very commonly requested is the forehead and the glabella region. And this region is super important when it comes to the aesthetic perception and also to the expression of emotion. And the good news is we have regular 5 layers in the forehead and the glabella, which is skin, subcutaneous fat, the frontalis muscle, the deep fat compartments, and the periosteum. But if you're anatomically ambitioned, you can find papers that describe up to 8 layers, which subdivides the frontalis muscle into the suprafrontalis fascia, the frontalis muscle itself, the retrofrontalis fat, and the subfrontalis fascia. So that's something you might want to have heard of, but it's not important for the scopes of this webinar. Due to its importance for the expression of motion, a lot of wrinkles form. I'm sure you've seen many of them. And we have to differentiate between dynamic and static wrinkles. So dynamic wrinkles are forming under the muscle contraction and they cannot be found permanently, while static wrinkles are even found when we have a resting phase. And this is something we need to keep in mind. So dynamic wrinkles need a different treatment approach than static wrinkles again. And the forehead and the glabella is also a very interesting region because we have quite a variety of different aesthetic concerns again. So we can find wrinkles, we can find photo damage, both pretty manageable with skin revitalization and skin boosting treatments. But on the other hand, we can also find problems such as a loss of bony fundaments. So many publications have reported on bony resorption in the upper facial third, and this might lead to a different appearance of the forehead, and this is also something we need to be aware of. And also an interesting aspect we haven't touched yet is seen right here. So you would say there's not a problem with the forehead, it's the ptosis of the eyes, and I completely agree with you. But we have to keep in mind that the patients are often not experts and they cannot really summarize their aesthetic concern very precisely. So when patients talk about having a concern, looking tired, then and they're attributing it to the forehead, we might also need to think about the periorbital region, which might be the cause of this. And the last region we want to touch in this webinar, also very commonly treated with skin boosters such as NCTF, is the perioral region. And the perioral region, just like the forehead and the glabella region, is essential when it comes to expressing emotion, to the aesthetic perception and communication. And this is also the reason why many patients want treatments of their lips and their perioral region. Again, we can make the anatomy in the perioral region simpler. Typically, to be very precise and to be very anatomically correct, you have to say that the muscles are arranged in multiple layers. But for the scopes of this webinar, it's simpler to say that we have a general 5-layered arrangement. And again, also we can see dynamic and static wrinkles. I'm sure you've heard many names already, perioral barcode lines, for example, marionette lines, also termed Merkel lines, the nasolabial sulcus. So there are many names and many aging signs as we age. Again, I would like to show you 4 patients with different aesthetic concerns. So on the left, we can see a patient concerning about the skin quality. This is something that can very easily be targeted, but we also have to differentiate if the wrinkles are being caused, just as we have seen in the periorbital region, by hyperactive muscles. So I'm thinking about the depressor angulioris muscle pulling down the corners of the mouth, and also if patients request aesthetic improvements of particular components of their lips. For example, in this case with the vermilion border, you can see as we age that the vermilion border actually inverts. And some patients want an eversion of this vermilion border, and this is something where we need volume additional to skin revitalization. Similar right here, we can see that the patient might have a skeletal or a dental loss, and this might also be something where we should treat the cause and can then effectively treat the patient's aesthetic concern. Thank you so much for your attention. I really hope I could give you some interesting insights. If you have any questions, you can just write them in the chat or you can reach out, whatever you like. And I'm really looking forward to the presentation of Valérie and Alessio, and thank you so much.
So, thank you so much, Michael, for your wonderful explanation of the 5 layers of the face with specific, how would I say, area from forehead, periocular, neck, where hopefully NCTF is not the only treatment, but that can be added to other specific treatments. So maybe we will have some, and I hope, question at the end that we will be able to answer. But do not hesitate, like Michael said, to present it in the chat. So now I'm going to present you may know it by heart, the NCTF 135HA, its indication, contraindications, and also the best practice to use it with cautious. So now NCTF is presented as an injectable solution. It is not a gel because there is just 3 HA of more than 60 ingredients for skin regeneration. And skin regeneration, whatever the treatment can be done as presented by Michael, toxin, HA, whatever, need to be regenerated at the superficial layers. That is to say NCTF in the dermis, the epidermis, and also in the hypodermis. NCTF is a real success. Since 45 years in the market, 13 vial cells by minutes, more than 3 awards. Why? Because it is an iconic product by itself, but also because it targeted the signs of aging, the real, how would I say, the real fibroblast from collapsed when it is either aging, either fatigue, and to become a young fibroblast, stretched to be still active, because we do know that to be active, the fibroblast with the key cells responsible for the synthesis of collagen, of good quality of elastin, of good quality of uric acid, is the cells responsible for good quality of the dermis. And for this, it has to be stretched like a good sportive guys. So there is many ways to stimulate fibroblast and to produce good collagen to regenerate the skins. There is mechanical activations, which there is a communication activation through the CD4 receptors. That is the receptor we are going to be fixed, the HA, to induce synthesis of collagen. And we do know that the collagen is mainly provided by amino acid, block of amino acids. And we do know that in NCTF, the formulations provided in the 60 ingredients, 24 amino acids. We do know since preclinical that the 60 ingredients selected based on science of cellular biology are at the optimal dosage with excellent tolerability to stimulate the fibroblast by a nutritive way. Let's keep focus on the vitamins, more than 12 vitamins, vitamin E, retinoid, but also vitamin C and I, which are very good antioxidants that are also responsible for the synthesis of collagen, and also the vitamin of group B. The free uric acid, or 5 milligrams per ml, so 15 milligrams in 1 ml, of high molecular weight. And we do know that more than hydrate, it's also an antioxidant that will provide, stimulate the fibroblast to be still active through the CD4 receptors. Let's go focus on 24 amino acids with the main amino acid which says essential aminoacids with glycine, hydroxyproline, lysine, isoleucine that are really contribute to the block, of collagen and elastin. More than that, we do have also 5 nucleosides, the DNA. Here they are for the synthesis of DNA and RNA, which are crucial, for regulation of the gene responsible for protein, collagen, and elastin. Then again, to contribute for the cell's metabolism, we do have 6 enzymes inside, for activation of the enzymes, 6 minerals, including calcium and magnesium, to ensure the support of cell metabolism and the homeostasis regulations. And on the top, we do have also one main ingredient, which is the glutathione, which is a more potent antioxidant. And all these ingredients contribute certainly for the fibroblast activations, for the melanocyte regulations, for and have many properties. On an aesthetic point of view, what we can expect from an immediate after an immediate protocol of NCTF, it's an immediate glow. And this immediate glow will be long-lasting and emphasis after 3 sessions. But something that will be, continuous cell stimulations to provide dermis density, tonicity, and tanning on a long-term skin regeneration, building strong organized architecture of collagen elastin. It will be, the stimulation done after 3 sessions of NCTF. That's why it's a complete regeneration, a real skin activation after the full protocol of the 3 sessions of NCTF. We do have some very interesting clinical study with instrumental data to show the dermis densification you can obtain after 3 sessions. More than 148% of fibroblast stimulation, inducing 256 collagen stimulations, and then the skin density. You obtain also 69% tonicity and plus 34% elasticity. You can see on these 2 instrumental data of echography how much we can produce after 3 sessions new collagen. That's why it's called a real regenerative solution. Now, when we look at the skin recovery, and NCTF provide also a kind of anti-inflammatory. That's why it is also very efficient in rosacea, in some acne, in vitiligo. And if you see the evolution of these different inflammatory markers, like interleukin 8, TNF-alpha, and histamine, you can see that with NCTF, the level of providing anti-inflammatory markers is significantly less important than our competitors. That's why it is so well tolerated. That's why also that beside all the aesthetic benefits it provides with glow, tonicity, densification, it also has some medical formulations. To be efficient, you need also to be fixed on a very rigorous protocol of 3 sessions spaced out of 3 weeks, and to maintain it on a regular basis of 2 protocols per year. If you want to treat face, neck, décolletage, and hand, maybe you will have to use 2 or 3 vials of NCTF. Something which is very important now, you understand the physiopathology of this fibroblast that needs to maintain in activity, to be stretched, that you have an optimized protocol in 3 sessions with cumulative, efficiency. And why 3 sessions? Why 3 weeks? Because we just adapt the number of sessions and the space in between to the cell renewal of 21 days. So To stabilize, it's important to have free session, and to maintain and to enhance the quality of skin, it's important to maintain it over the years. So you can also, like presented very well, Michael, thanks again for your fantastic presentation, have a full face with specific, how would I say, injection techniques for the neck and décolletage and the ocular with 32 gauge, or the nanosoft, which is equivalent of 36 gauge, with 3 nanoneedles of 0.6 millimeter each. It's important also to target the small wrinkles and fold, to use either 32 gauge needle or nanosoft, and retrotracing with a 30 gauge. But to target the delicate area, do not hesitate with the nanosoft to create some small papulas that will be disappeared. And even on all the face, I know that my colleague Ricky Smith liked to inject all the face with nanosoft. And for the barcode, when you just fill the fine wrinkles with fine lines on the top with nanosoft, you can take benefits of the lidocaine bring by the fine lines to just correct and stimulate very delicately with nanosoft and NCTF. Nanosoft is an exclusive FILLMED device. It's called the smallest, the smartest. It is made of pure silicone. It is CE marked, and you can adapt it, on each kind of the range. The still prerequisite is to be well trained about it, but it is very easy. You just have kind of barcode in the FILLMED e-Academy, blue line in front of you, respect 30-45 degree angle when you inject it, grab the skin and inject a small pressure, some papulas that will deliver over the time, the NCTF released. As you may know, the multi-layer product approach is very important. Michael presented to you. On the top, you have cosmetics with skin perfusion. In the middle, biorevitalizations. And also, the deeper you go, the more tangential your needle is. Safety tip with nanosoft is very important, and I would say some safety tips also with biorevitalization. First, the patient selection. Remember what presented Michael concerning, please, all the lymphatics around the eyes. As far as you have some edema, risk of edema or Parkinson, it's a totally contraindications. No makeup before, total disinfection of all the range. It's not a surgery of the art, but it has to be totally disinfected, the skin, and also if you use gun, remember the gun has also to be disinfected. Minimal trauma, you have to be delicate because the skin is very sensitive, especially on the orbital. Main of the side effects that will presented Alessio are in this area because you have to be delicate. It is the thinnest skin with the neck of all the body. You have to respect either the nanosoft or very soft with at least 0.6 millimeter. As the skin is a reservoir, you have also to respect 1 centimeter between each injection point. And for beginner of nanosoft, please try to the neck. It's much more easier to try on the neck to follow the line and after to go in these delicate areas. Remember also something, the NCTF by itself, or 60 ingredients, is a kind of real good, cell medium for bacteria. So as far as you open 1 or 2 or 3 vials for your patients, you have to throw it again. You don't keep 1 vial, half a vial for the next day. Very important. So this good cell medium, which contributes to stimulate the fibroblasts, can be the best enemy if you inject it 1 day after. So now this nanosoft is very important with all this region. It goes just targeted, the dermoepidermic junction with very good, efficient quality of results. I would say even quicker and with less pain with classical needle, less painful, much painless, of course, and lots of patients prefer it, especially on this delicate area. It is very important in order not to provide trauma, which could induce more inflammation, to be very soft. If you inject perpendicularly 45 degrees, you grab the skin. Just please do, if you didn't have seen it, go to the little video of training. It is very easy to benchmark. So precaution of use, patient selection first, which should be totally remove of makeup and disinfect. Minimum of pressure for beginners, start on the neck. And as you know, NCTF is a very good cell medium sterile product, which has been sterilized, I remember, by double filtration to maintain and preserve all the vitamins, activities, and ingredients. So it has to be selected for one patient and after use through the vial. So these safety tips is, of course, prepare the skin, to use gloves, to makeup removal, and not to use makeup one day after, and to avoid sunny exposure for 48 years, except if you have some SP50. So there is different kind of injection technique. You have the epidermic one with a 30 gauge needle, which is very interesting, to provide glow, to provide hydration, and very easy to use with this 30 gauge needle, 13 millimeter. After you have the dermoepidermic junction, second you can use with a 32 gauge needle, so you are 30 degree perpendicular, very interesting for the fine wrinkles, for the pore size reduction, and I also use it in the mandible line to maintain a good jawline. Now, it is also important if you like to use mesopen, mesogain, or whatever comfortable you are with the device, and also do not overcorrect, overtreat the periorbital region, please, because it's here that we can have the most, not side effects, but not good tolerability by the patients. If you respect all of this, just look after 3 sessions of this 42 years old woman, how elegant she became, her quality skin improves the tonicity, the density. She even have a lift effect, correcting the nasogenial at the starting point of the marionette line. Look at her periorbital region, look at her frontal and her neck, look at these guys above the glow, the tonicity, the density, and the correction of the wrinkles is something amazing. And so the contraindication, never inject in blood vessels, of course, excepting if you cross the vessels. Do not use it when patients have skin alterations or history of immune disease, immunotherapy, hypersensitivity, active acne, pregnant or breastfeeding, of course, and children. And the precaution of use is important, especially with anticoagulant treatments, but you can use it anyway if you remain very subtle. And you do not have also to have prolonged exposure on the sun, like for all aesthetic treatment, I would say. And also you can use if you want, but personally I don't, excepting if patients are very, cautious, use anesthetic cream and do not inject, of course, into beauty spots. So the safety tips, NCTF is sterile. So all the vials have to be used entirely when it is open, please. And there is no need to conserve it in the fridge, but you have to avoid sun exposure in order to maintain its activity. And you have to also verify the originality of the product thanks to the proof pack. If some things occur, because it can always occur, you have to contact vigilance@FILLMED.com and to explain what's happened. You have to know that you are not alone. There is 2 people designed and trained in your country to answer, what's happening. So please do inform vigilance@FILLMED.com, and we are here to explain you what to do. So this is, you have to declare your patient, your product, what is your undesirable side effect. And it is important to have, of course, the batch number and detailed description of the effect. So it is very important, material vigilance, because it is also part, of the safety of the product. And it also improves the knowledge of the product, how to use it. And it is part of the whole, how would I say, added service of FILLMED. So this is the survey, but now I will let, if you want to answer, I will let the show to Professor Readeali, that will present us which kind of cases he made and how to solve it. And I will be very pleased to answer you with Michael and Alessio at the end if you have any questions. Thank you very much. Alessio, it's you.
Thank you. Thank you, dear Valérie. And I wait a moment because now I can share my screen, but in a few seconds, if you close your connection, Valérie, please. Oh, thank you.
Sorry.
So that no problem at all. And I share my screen. And okay. And we heard by our colleague Michael and Valérie how to avoid. I present myself very quickly. Alessio Readeali, living work in Milan, Italy, and I work on the complications. Valérie told us how to avoid. And honestly speaking, if you follow these easy rules that honestly we use for everything in aesthetic medicine, good disinfection and so on, it is quite totally rare to have a complication. But anyway, we had the possibility to see some complications that now we will see, to try to understand what caused this totally light complications. We had the possibility to standardize the complications, and for this we choose this International Medical Device Regulators Forum, IMDRF. And with this, we will be able to create a coding system. This forum created a very interesting and very updated coding system for all adverse events related to medical devices, harmonize the terminology so that we can know exactly what we are talking about, the code information relating to all adverse events and complication, and have also a common terminology, both for manufacturers, regulatory agencies, but also for us, doctors. And so here you see the main codes for the main adverse events that we saw for NCTF and MHA 10 that are the free hyaluronic, that contain the free hyaluronic acids from FILLMED. The swelling, erythema, nodules, granuloma, prurite, burning sensation, itching sensation, skin inflammation, hypersensitivity, papula, and the quick edema. And here you see, anyway, the real percentage and incidence related to complications in 22. For NCTF 135HA, we had an incredible number of techniques and injections done all over the world, and we have really nothing. There are totally no complications, and 0.002. So really nothing. And also for NCTF 135 and MHA10, you see that the rate of complications is very low. But also one complication, of course, can be important. And all the doctors, since FILLMED organizes a lot of academies, you know, the E-Academy, and many other courses to learn how to use. It's very rare that somebody makes some mistakes. But I think that quite in all the cases, not all, but in the great percentage of complications, it was done the technique was not done so precisely. And so, first of all, it's normal to have some papules. This is the normal effect of NCTF, HA, and NCTF normal and MHA10. You inject superficially, and these papules can be visible. If you inject too superficially, it can last a few hours more. But normally, you can inject NCTF also superficially and do not last more than 24, 48 hours, but in normality, few hours. Then this is the first, swelling. Swelling can be, of course, can happen, and the incidence was 32 cases in 22, for us very frequent. It is an early complication, but swelling is related to the technique quite always. You see this lip, the patient was particularly sensitive, but the doctor injected a little bit too much in the lip, and here the papules were very nearby. Also, on this patient, there is also some redness, some erythema that can be possible. This is a patient that I had to follow. You see micropapules 0.25 ml per side that could be nothing, honestly. Instead, for this patient that have done also botulinum toxin before, the papules were too nearby. So she had for 5 days. Treatment was only arnica cream. If you want to speed up the process, you can use also a cortisone cream or an antihistaminic cream before, but no oral medications. But this was the papules too nearby each other with many times erythema, a type of skin rash caused by injury or inflamed skin. Also in this case, maybe it was not used the nanosoft needle that reduces and instead a 30 gauge needle that creates in the confection. I remember you that you have all the needles, not the nanosoft, but the 32 gauge. So don't use the 30 gauge because it is too thick. And instead with the 32 gauge needle that is provided with the confection, you can reduce to a minimum. 32 cases also, because you see again in the periocular area, and there is a reason why that Michael told us, the lymphatic system and so on, you can have some cases. These are cases that I followed personally that lasted for a few days and didn't not proceed to any measure. The disinfection, when you have deep wrinkles, and also here in the eyes, in the lower eyelid, we have to disinfect stretching the skin because we have some deep wrinkles. In this case, probably a particular skin, it was not disinfected thoroughly, stretching the skin, and we had for some days, in this case, maybe a cortisone and antibiotic cream can be the good possibility. Some nodules that you can have, you see, this is an incidence, 11 cases in all 2022, subcutaneous, either fibrotic or granulomas, or maybe in the first days can be also a light bruise that can create, maybe if you inject again instead of the needle provided, maybe too many injections with a 32 very, very thin. Anyway, passed also this totally in a few days. One granuloma we had in 2022, and no totally granulomas for MHA10. Granulomas thought to be because of allergic or inflammatory response, maybe an antibiotic cream, or maybe sometimes in few cases you can use also an oral antibiotic systemic to reduce this problem. Again, disinfection, especially in patients with deep wrinkles, like in this case, can be the possible. Then we have some, this was a particular case where many injections have been done with some induration. You see many bruises that appeared locally, and a little bit too much material injected. The inflammation, the induration, the erythema, the pruritus and pain can last for some days. It's very important maybe to apply a cream, a light massage, and avoid to make too many injections, like in this case. Maybe in patients that take a pans or some aspirin and so can bleed a little bit more. Burning sensation also frequent when you inject, for NCTF, when you inject a little bit too much, can be related to a nerve problem, a nerve irritation, injuries, infections, and autoimmune disorders can maybe trigger these points. So a good anamnesis in these patients with, for example, autoimmune disorders, better to inject a little bit less and not avoid to inject too much. Itching sensation also can occur up in several days post the treatment. Honestly, I had very rarely, and in these cases, maybe only a local clinic. 10 cases in 2022 for NCTF, and one case in 2022 for MHA them. Also for mechanical, thermal or chemical mediators that can trigger this sensation that normally lasts for few days. Inflammation. This was a particular case that arrived to our vision. Skin inflammation can occur due to trauma of injection. Again, we have an incredible device that is the nanosoft needle. I should use for this area nanosoft that eliminates quite totally, if you inject in the right way, like Valérie told you, can be a very good possibility. Hypersensitivity and allergic reactions, this is a possible case of allergic reaction, even if also in this case, in my opinion, there were too many injections and too nearby. Mainly 2HA can happen, some swelling. If you have this suspect, maybe you can do also a patch test that can confirm your diagnosis. And we had these papules that if are too many can arrive to a complication, to an adverse event, but normally if you inject a few amounts are really very rare. 48 hours, 24 hours can be normal, but in my experience, if you inject safely and with a light quantity, do not happen. We had one case of quick edema. Of course, this needs the treatment immediately with cortisone, and the angioedema is, for this reason, you must have a safety kit in your clinic immediately, the cortisone, and maybe also adrenaline. All of these must be ready immediately in your office to avoid that raises to a worse level. Now, question and answers. Before I give back to Valérie the stage, remember that inside you have all the undesirable effect, all the contraindications that you can see. Respect this, because this is also very important. Valérie, back to you the word, because I guess that there are many questions. Thank you so much.
Okay. So, hello everybody again. We have very interesting questions about can NCTF be used for periorbital static wrinkle in patient with a Botox allergy? Alessio, you are one of the experts of botulinum toxin. What would you say?
Botulinum toxin, first of all, for example, CrossFit, all the lymph inside the eyes is spread out by the muscles and block totally the muscles and the lymphatic system. We know that can raise some swelling in the lower eyelid. So first of all, I prefer personally to do first botulinum toxin, and then after some days, 10, 15 days, you can do. But also you can do before the normal cycle of 5 sessions, and after this. Honestly, I had very rarely these complications, especially anyway, CrossFit and here. Very few amount, very good disinfection can avoid this problem.
Good. I would add something. Now I do, the protocol of NCTF plus Botox, and I like it very much. That is to say, when the wrinkle on the periocular region are quite deep, I like to start, first of all with NCTF, my 32 gauge, to fulfill the wrinkle. And after, I think that I inject 1 month after the 2 sessions the Botox. And it is honestly much better and quality results.
I totally agree with you. Microbotox, I don't know if you remember, I published this technique 20 years ago, and we had a very interesting chapter with Christopher Roland Payne. So it is a very well-known technique, and I use all over the face. I prefer to do mesobotox or microbotox in the lower third, neck and décolleté, and instead in the upper third, I prefer to use the normal Botox. In the same session, I do NCTF and botulinum toxin. You do this way?
Not in the same session for the first time. I prefer to start with NCTF, and when they come back, I do NCTF first and after Botox, at the second, because I want, the skin to regenerate, and, there is communication, and after I do NCTF and toxin after. And I start to do NCTF dilute, Botox dilute with NCTF to start, with a nanosecond neck, which is excellent. Thanks to you.
Neck and also décolleté, where we don't have so many masses, important superficial masses, but the results are really incredible, and the complications are so low. Better to do very good stretching the skin, disinfection that is so important, because in the depth of the wrinkle, there are some bacteria, some worse material that can be cause of big papules, as we saw in the case before.
And Michael, you are today our experts of anatomy and layers. Do you have some things to add about it? Because it's something very, today fashionable in our communication, to mix, to add, to prepare, to combine. What do you think about it?
Especially combining Botox with NCTF should work just fine when thinking about that the muscles actually insert into the skin, especially in regions where we have a lot of facial expression. This is definitely a good idea in my opinion, and also from the effects I've seen so far, well, I think the effects speak for themselves, so there's nothing speaking against it actually.
Okay. So I have another. Yeah.
I have a question for Michael. Mika. Yeah. You spoke about the subcision in the neck, and this is a very interesting, not with the needle, but with cannula. And then the idea is to inject, after the subcision with a cannula, to inject NCTF very superficially. Which cannula you suggest, the longness of the cannula, and which is the exact layer where you do the subcision, and how to avoid the main complications?
Yeah, okay, so in the publication they were talking about subdermal subcision with the cannula, so they were hypothesizing that the retention fibers actually insert into the skin and travel from the platysm towards the skin. But in the same publication, they showed that intradermal injections were more effective, actually. So they kind of rejected their hypothesis based on their findings that intradermal injections were the ones to use for better aesthetic results. So based on the study's results, I would suggest intradermal injection rather than subdermal subcision. Are you doing subdermal subcision with cannula, Alessio?
Well, quite always I do from 2-3 points, and with cannula I do the suspension, and then I inject the BioNutri lift or BioNutri lip, the same BioNutri neck. Okay, that, in my opinion, is very good, very superficial.
Okay.
NCTF and deeper, a soft filler.
Excellent.
Exactly. So if you had to choose between subdermal subcision with cannula or intradermal injection, I would go with intradermal injection, but I agree that probably combining both yields the best effect. So that's probably the way to go here.
So thank you, Michael. Still about injection, when you do not have nanosoft, what do you use for periocular region? What is your choice of needle? Personally, I use 32 gauge.
I use nowadays quite always nanosoft.
Yes, but if you do not have it.
32 gauge, of course. Sorry, I didn't. 32 gauge is a very good needle. It is the very famous leather needle, 4 millimeters, and it is a very thin needle. Of course, if you, in all the countries where you don't have nanosoft, the 32 gauge needle is perfect. Attention to the veins in the periocular area, because possible some bruise. It's always, and don't inject too much, because NCTF is very easy to inject. Alessio,
I have a question from Canada for you. Please. Hello from Canada. If you combine Botox with NCTF, do we have to use that vial on one patient only? And or do you mix it with Botox?
Well, I guess that the colleague intends botulinum toxin, not Botox specifically. I prefer, for example, I prefer botulinum toxin A. So in Italy, around the world, Dysport or Azalu, and I dilute one vial in all the 3 ml of NCTF, and I inject, as I told you, in the mid lower face, neck, and all décolleté until the first cost. This is my dilution, and then I use the 2 ml syringe with, if it is possible, the nanosoft. Especially in all this area, I saw many times some little asymmetries, because also if you inject with NCTF, botulinum toxin can be very active, and so you can arrive to the DAO and have some little asymmetry. So pay attention in this area. If possible, the nanosoft needle avoids this, because you inject at the basal
0.6.
If you inject with 32 gauge, attention not to go too deep.
Of course. So there is a question concerning patients under chemotherapy that finish their treatment and want to enhance their quality of skin. What is your recommendation concerning the length of time between to inject NCTF?
My opinion, if the patients are doing chemotherapy, active chemotherapy, I don't do any.
After all,
I wait 2-3 months when they have finished, and anyway, I ask the permission to the chemotherapist to have to be sure that everything can be done, even if it's totally safe.
Yes.
But anyway, I prefer to wait.
Yes. I think it's different. Is patients in remission since 1 to 3 years? Here it's okay. But totally with you, I do not inject before 6 months after the stop of the treatment, and I always ask the chemotherapist, the cancerologist, what about to do or not to do. Then there is a question, very quick question about MHA10. MHA10 is just pure uric acid, free uric acid. We do not make a lot of promotion of it. It can be used sometimes when the skin is very dehydrated, but it is injected exactly the same like NCTF 135 HA. But on one hand, you have 60 ingredients in 135 HA. On the other hand, you have a very good quality of just pure uric acid. So you have 30 milligrams of free uric acid, and you can combine those. Now, there is another questions concerning how many units of Botox do you mix in 3 ml of NCTF for the neck area from Philippines?
So Botox, normally I arrive max to a vial of Vistabel. Using Botox in Italy, we don't have because it is only for hospitals. And so I use 50 units dissolved in 1 vial NCTF. As I told you, same for mid-lower face, neck, and décolleté. This is my dilution. But you can also be you can inject also less, and there are instead the doctors that inject more until 100 units. So my opinion is that better to be cautious and don't dilute too many units.
Yes, I agree, because this webinar is about safety and NCTF, so I think it's a very good conclusion. I want to thank you very much, all of you, about your contribution to just enhance the level of knowledge about from anatomy to product to ease of use to extension, I think, of use when we add NCTF Plus. And I wish you a very good evening, and I hope to see you soon. Thank you, Alessio. Thank you, Michael.
Thank you. Thank you to all the colleagues.
And thank you to all the colleagues that attended this webinar. You will be able to see it and replay on FILLMED e-Academy. And do not hesitate.
Thank you, FILLMED.
Thank you, Alessio.
And thank you to you, Valérie.
Thank you. And do not hesitate through the QR code to give us your feedback and to ask from other kind of session. It will be relevant for your practice.